Hi, I'm Jeff Zeig, and I'm the founder and the director of the Milton Erickson Foundation. And here you are in Phoenix. This is at the Erickson Foundation offices. The idea today is 5-minute tips. 5-minute tips about how you can improve your work with anxiety disorders. And we can think both about assessment and a little bit about treatment in a very short period of time. First of all, in the assessment of anxiety, we could be thinking, how is this person anxietying? How is this person doing anxiety? Now, for the patient, they feel as if the anxiety just descends upon them, as if it's coming somehow from the internet into their body. But in order to do anxiety, in order to have anxiety, you have to do anxiety. There's some process, perhaps outside of consciousness, that the person is doing anxiety. Is this person doing anxiety by tensing their body, something physiological? Is the person doing anxiety by imagining pictures of a bleak future? Is the person doing anxiety by beaming themselves into those pictures and imagining some catastrophe and bringing that catastrophe into the present? Is this person doing anxiety by overfunctioning, trying to do too much in too little time? So one of the things that would be important is to understand this individual. How does this person do anxiety? Now, a principle that comes from Gestalt therapy is, if you're in terror, play out the terrorizer. The person feels themselves to be the victim of their anxiety, but you can ask the person to go outside of their anxiety in the scheme of assessment and, for example, put themselves into the chair, be the part of themselves that makes themselves anxious, and exaggerate that part. And how could that play out? Well, you're going to fail, you're not going to be good enough, you're going to embarrass yourself in public. Exaggerate that. Oh, you're going to fail, you're going to not do good enough, you're going to embarrass yourself in public. And bring out the persecutor. Now, we know that every drama requires a persecutor, a victim, and a rescuer, but people who are in an anxiety state, they are often feeling themselves to be the victim. And oftentimes, if a therapist plays out the terrorizer, the persecutor, then it becomes more clear about what is a channel for change. And that channel for change could be even a simple reframing model. What is the intention of the persecutor, which could be to make the victim strong. Now, in order to finish the drama, we have to have a rescuer. The drama is that, for example, in a metaphor, there's Snidely Whiplash, who has the damsel in distress, and she is tied to the railroad tracks. We need Dudley Do-Right to come in and complete the drama, defeat Snidely Whiplash, and save the damsel in distress. So sometimes, if a therapist is organized around this idea, if you're in terror, play out the terrorizer, you can create a rescuer in some metaphoric or real form that can tidy up the drama. Now, one way, once you've done an assessment of anxiety, one possibility is redefining. Sometimes when you redefine a problem early, it makes a remarkable difference in the person's perspective. Anxiety is interest on a debt that you don't know. Anxiety is interest on borrowed trouble. And so by giving the person a different perspective early on in the treatment, sometimes that can have a palliative effect. Now, in terms of treatment, probably the worst thing to do is to suggest relaxation. Rarely do I suggest relaxation to a patient who is anxious. Sometimes it's the right choice. But think about this metaphor. If you go into a dark theater, it takes you 20 minutes for complete dark adaptation to happen. But if you go from a dark theater into the light adaptation is immediate. In other words, because people get anxious immediately, they think they should be able to relax immediately, and relaxation, if you could ever have ideal circumstances, would probably take 20 minutes to completely relax. So even in contemporary cognitive behavior approaches, the watchword is, how do you manage the energy? Anxiety is an energy. Think about ways that you can manage it. If we're thinking from a paradigm of Toastmasters, where people would get up in front of a group and they would have to practice giving their maiden speech, the watchword there would be, it's fine to have butterflies, just get the butterflies to fly in formation. So rather than trying to extinguish the anxiety, which is very logical, people are very logical, they think, okay, we should just do the logical thing, which is relax. But when they try to relax and they're not easily successful at relaxing, it may stimulate their anxiety. Therefore, developing a paradigm, anxiety is an energy. It's an energy that you can use. How can you begin to focus that energy? And developing different practices, different metaphors that help people to alter their anxiety. Now, just coming back for a minute into the assessment of anxiety, thinking about what are the things that people do, what are some of the substates that they enter. For example, beaming into an unpredictable future, bringing that unpredictable future into the present. For example, there are linguistic patterns that people use in order to generate anxiety. What if, what if, what if, what if? And if you say 3 or 12 or 17 what ifs, probably you can develop yourself into an anxiety state. Sometimes what people are doing is they're generating anxiety by doing something that's somatic. So there's substates, there are somatic channels into anxiety, and if you're tensing up, if you're holding your breath, if you're perfusing your body with carbon dioxide, you'll feel anxiety. There are social patterns to anxiety. Hanging around with nervous people certainly could be a way in which somebody could generate anxiety. And there are sequences. Anxiety is not a thing. Anxiety is a sequence of behavior. Sometimes if you assess the sequence of behavior, you understand an avenue for how to disrupt that sequence. There are some tips, some ideas, some ways of thinking. How could you work with anxiety? This is your 5-minute from the Milton Erickson Foundation tips about thinking about ways of helping your patients who complain about any kind of anxiety. Situational anxiety, the anxiety of a phobia, the anxiety of generalized anxiety disorder, even the anxiety that can accompany PTSD, or the anxiety that can accompany OCD. Look forward to our next presentation, another 5-minute tips for how you could work with different clients.